Hello and welcome to part one of the three-part video series entitled Test Question Construction for ISTE Committee Members. I am Maria Caterina Lat-Herin. At the end of the lectures and workshop, the members of the ISTE committee will be able to create appropriate learning outcomes with corresponding test blueprints and good test questions. We will also critique the learning objectives, test blueprints, and test questions of others with compassion. As we enter the 21st century, health professions educators realize that there's a need to acquire 21st century skills by our learners. There are 12 of these skills, and among these, we'll focus on the learning skill, which is critical thinking, or the ability to find solutions to problems. This is the reason why we need to make improvements in our test question construction, because this is the 21st century skill which can be improved by exam taking. We are here because we want to teach and train future health professionals who are not only compassionate, but most importantly are also competent. We want them to be prepared for what is out there. And why do we give assessments? The three main reasons are, first, it is the most common way to find out if our trainees learned anything from our instruction. The second reason is to motivate them. When our trainees see that they are improving, that they are achieving the goals that they had set for themselves, then these assessments actually may push them to keep it up or to be better. And lastly, for us, as the trainers, to see if there is anything in the way we are teaching or training that we need to keep doing or to change, especially if we see that we are not achieving the goals that we have set out to do. There are basically 10 steps in test construction. However, for our activity, we need only concern ourselves with determining what the major content to be tested are, preparing the test blueprint, constructing the test items or the multiple choice questions, and during the workshop, evaluate and critique each other's work and revise them accordingly. The reference of the written examination of the Philippine Board of Dermatology is Fitzpatrick's 9th edition. Most of the time, we divide our exams based on the chapters of the textbooks. It is from here where we base the content of our exam questions, and we use Bloom's taxonomy to guide us in making our learning objectives and test blueprint. Now, in order for us to come up with good questions, we first need to create the appropriate learning objectives or outcomes and the test blueprint or table of specifications, since our questions will be anchored on those. The learning objectives are the aims or the end point of the instruction. What is supposed to be achieved by the learner at the end of the instruction. A shortened criteria is called SMART, which stands for short, measurable, attainable, relevant, and time-bound. We use verbs from the revised Bloom's taxonomy. Remembering, understanding, and applying are considered lower order thinking skills or LOTS. Analyzing, evaluating, and creating are your higher order thinking skills or HOTS. The HOTS are geared towards that 21st century skill called critical thinking. And it is because of this that we will, as much as possible, create HOTS questions 100% of the time. It is understood that the examinees will need to know basic knowledge for them to be able to answer HOTS questions. So having HOTS questions will make LOTS questions unnecessary. Here are examples of learning objectives as they are seen in a sample lesson plan or instructional design. Formulate would be a higher order thinking skill belonging in the category, the creating category, which is the highest in the revised Bloom's taxonomy. Demonstrate belongs in the applying category, which is in the lower order thinking skill. And critique belongs in the evaluating category, which is in the higher order thinking skill. After you have set your learning objectives, you proceed with creating your test blueprint. The test blueprint or table of specifications is the guide for writing the test items. Having a test blueprint will ensure that proper emphasis is given to all elements. Step 1 is listing the objectives or content areas. This is usually put on the left-hand most column. Then you determine the weights or the number of test questions or percentage for each content area. After which you decide on a second dimension to constitute the other columns. Will you be creating questions that are analyzing, evaluating? On a side note, please remember that MCQs can never test for creating. So please make sure that this column is unfilled for MCQs. Then you determine the number of test questions or percentage for each item in the second dimension. Lastly, you complete the table. Let's go through that again. You start with your objectives or content, followed by the weight of your content. Then you determine the second dimension of your questions, followed by deciding on the number of questions or percentage for each second dimension. And lastly, you complete the table, producing your test blueprint like so. From your test blueprint, you may proceed to constructing your test questions. There are different types of assessments where multiple choice questions may be used. Diagnostic assessments are used to check the level of the knowledge of the learner prior to the instruction. This is your entry-level knowledge. An example of this are the pre-tests, which we have been giving our residency training applicants. You also have your formative assessments, which are given during the course. It can answer the question, are they learning anything? And it can assess both the learner and the process of learning and or teaching. This is where we come in as ISTE committee members. The objective of giving in-service training examinations is to assess how the trainees of the different institutions are doing while they are undergoing their respective trainings. Summative assessments are given at the end of the course. This validates how the content supports the learning objectives. The Philippine Board of Dermatology examinations are summative assessments. This ends the first part of the 3-part video series. I will see you in the second part where we will be talking about the do's and don'ts in creating multiple choice questions.